Hello, welcome to the University of Brighton podcast. I'm Richard Newman. Over the past month or so, we've been concentrating on the response to the coronavirus pandemic in all manner of ways, and we'll continue to do that over the coming weeks. But what we haven't discussed yet is social distancing and the lockdown itself. To talk about that this week, I'm joined by Dr. Chris Cockings, Principal Lecturer in the School of Health Sciences. Chris, we've had approaching 4 weeks of lockdown. How are you finding everything?
Me personally, I'm kind of just getting along with it. You get into a little routine of doing things. I mean, obviously, the research I've done and how people deal with these things has helped because it's made me realise that the vast majority of people are resilient. So that reassures me.
It's great to have you on to speak about this. Tell us a bit about your background and area of research, first of all.
Okay, so I've got a kind of dual background. Academically, I'm a psychologist by trade. I'm a social psychologist, so I'm interested in looking at crowd behaviour, collective action, all different ways when people come together, be it at a festival, a gathering, in an emergency or a demonstration. So that's my kind of thing that I look at academically, is how do people behave in crowds. And I also did my nurse training at the University of Brighton as a psychiatric nurse, and I've worked with young people in child and adolescent mental health services.
Let's talk about what we're all going through now then. The lockdown has been extended as expected. How do you think the public have responded to it in general?
I think people have behaved remarkably well. That doesn't surprise me. That's what I would have expected. I remember I was interviewed by Sky News just as the lockdown was coming into force. And the pundits and the politicians at the time seemed very concerned about people's adherence to it. And when they're talking about people's adherence to it, which is what myself and other colleagues who researched this would have expected, they all seem quite surprised, but people do tend to behave remarkably resiliently in public emergencies. The crucial thing is how do you kind of take the mass of the people and encourage them that this is the right and proper thing to do, and it's for everyone's collective well-being to do it. But no, I'm not surprised that people do seem to be sticking to it, and I'm pleased that they are.
Yeah, before the main lockdown came in, there were lots of reports, of course, in the media about people ignoring the guidance. But since the measures have been brought in, it has been largely adhered to, hasn't it? And we've even got through a really sunny Easter weekend, which I guess MPs probably might have been a bit nervous about that. Did we not give the public enough credit to start with?
No, we don't. I don't think overall the public are trusted to behave well in emergencies, and that was reflected, for example, in the media reporting of what would have almost certainly been a minority of acts of people, and this is something I was interviewed about Sky News, people going out to beauty spots before the lockdown properly came in. And it's not to say there isn't a problem, but this was a very minority behaviour that was going on. And the crucial thing that myself and other psychologists do is how do we create social norms to encourage people to do the right and proper thing, which is to obey the lockdown. And one thing I'm constantly saying to the media is that if you report instances of people behaving in individual and or selfish ways, such as visiting beauty spots or stockpiling, what the media often wrongly call panic buying, that creates a social norm. If people see that on the telly, they then think, well, okay, I can do that as well. I need to do that as well. And it creates a self-fulfilling prophecy. And I'm constantly saying to the media, if you report things as panic buying or people going out and seeing beauty spots, you will create a self-fulfilling prophecy. And whatever behaviours you are seeing at the time will escalate after media coverage of it.
And I know you don't like the term panic buying itself. Do you think then that was all driven by the media, essentially?
I think the media had a very large part to play. I would be careful to say that there wasn't any stockpiling at all before the media reported it, but in previous instances of stockpiling, for example, in the fuel crisis of 2012, it almost always increases exponentially after the media reports it, because it creates a social dilemma. If people see what they think are limited resources, in the fuel crisis it was petrol, more recently it's been toilet paper. If people see the media reporting empty shelves, people will then go out and think, if I don't go out and get my supply, I will lose out. And so, yes, it almost always increases it, and whatever little behaviours there are. And I've seen even some farcical situations where the media have almost been trying to create the situation where they've been running up and down petrol forecourt queues, for example, in 2012, trying to interview people saying, are you panicking? Are you scared? And they're sitting in their cars going, no, I'm really bored. I really wish I wasn't here, but I need to fill up my car with petrol. And so the very idea of calling it panic buying, which implies that in a sense some people are anxious, they're fearful, they're panicking, is just ludicrous. It's not backed up by the evidence at all. You know, no one, for example, is having a panic attack while they're doing this. So to call it panic buying is nonsensical, and it creates a self-fulfilling prophecy.
So that might be part of it, but then obviously you're also seeing, if people are doing it, you feel like you might have to do it. We see it on a non-emergency way when you might even go on a flight and you're sitting in the departure lounge and suddenly everyone starts standing up to go and get on the plane when they know they've got their seat, and everyone else has to start doing it, even though you start saying, oh, why are they doing it? It's a sort of, if you see people doing something, then you might do it yourself anyway, right?
Well, there is a danger of that social norm being created. So what you need to do in that situation is say, look, you don't all need to do it. And a very good example of people who are getting up to go for flights, what they do now is that people with priority boarding and people with vulnerable members of the family or small children, they say people then, they have priority first, and people tend to respect that. So, for example, you don't tend to get a search when they start boarding, and people allow the people with small children to go on first before they then board. So it's not that individual behaviour can't be problematic, but it's how do you create the social norms to say, look, you've all got a seat, you're all going to get on, there is no rush.
Behaviour now has quickly changed, hasn't it? I mean, queuing in 2-metre gaps outside food shops now suddenly feels a bit normal. It's only when you really think about what's going on that you can find this current situation quite odd. Does it show how resilient we as a population are, how humans are really quite malleable?
Yes, absolutely. I mean, a colleague is doing some research with the hashtag new social norms on Twitter, where they're being encouraged to report through what they see as new social norms. So, for example, the social distancing is a very good example. And some people have even said it shouldn't be called social distancing, it should be called physical distancing. Because I'm noticing anecdotally, and this is backed up by a lot of evidence, is that while people are sticking 2 meters away from each other, people are making eye contact more, they're talking to each other more, they're making space for people, they're letting people go in front, and then people are nodding their head in acknowledgement and saying thank you. I'm certainly doing it more. I'm talking far more with my neighbours than I used to. So even though I'm not getting within 2 meters from them, I'm striking up conversation. So I would say it's physical distancing rather than social distancing. And people have virtual ways of communicating with each other. Skype, Zoom, and lots of people, myself included, are now having weekly Zoom meetings with friends and family instead of going out to the pub.
Pub quizzes becoming a massive thing. I don't think they've never.
I'm doing one this weekend.
Yeah, well, there we go. Never been so popular, have they?
Yeah, exactly. So social distancing is a bit of a misnomer.
There is a theory that an extended lockdown could create some sort of, I guess, let's call it physical distancing fatigue. Do you think people will get bored and many may start ignoring the rules? Or not, maybe not many, but more people may start ignoring the rules, because it's been a long 3.5 weeks for many already. Not everyone has access to, a garden, or some people are living on their own. And so it might be a bit tougher on some than others.
It's difficult when you're talking as a social psychologist to make predictions about the behaviour of everybody, because there will always be outliers. But generally, I think, yes, if people are reminded of the need for it to save lives, then yes, people will stick to it. I mean, it's an interesting thing that we talked about, myself and other colleagues in this area, about the fear of lockdown fatigue. I understand that it weighed heavily on ministers' decision to delay the lockdown. They were concerned about would people get fatigued by it. And it's something myself and others said. We signed an open letter that we are not aware of any credible evidence that people do get fatigue of necessary measures. If they know that there is a need to do it and the social norms are there, the majority of people will adhere to it. And the example that I often use is the behaviour of the Home Front during World War II, during the bombing campaigns of British cities and German cities in World War II. is that before the war started, the authorities were terrified about hundreds of thousands of casualties and millions of psychiatric casualties of people not being able to cope with the bombing of civilian cities. And the interesting thing about the data they found is that the home front never cracked. 30,000 Londoners died in the Blitz, and I think over 2 million Germans died in the bombing of the German cities later on in the war. And the home front never cracked. The social fabric never broke down, and after bombing raids had finished, people's social lives quickly then re-established within the physical devastation of their cities. So people are remarkably resilient in the face of ongoing threats. And so, for example, the bombing of German cities, that went on for a good 2 or 3 years. And there was no evidence at any point that the home front ever cracked, which was the stated campaign behind the mass bombing of German cities. It never actually happened.
We don't really know how all these decisions are made by MPs. We keep being told it's guided by the science, which is quite a generic term, isn't it? Do you think there's enough being talked about from like a psychiatry point of view?
From a social scientist point of view, no. And it is something that we've talked about, that they do seem to have a selective and skewed interpretations. And I suppose the problem with this outbreak is that you've got many different scientists to talk to. You've got the virologists, you've got the epidemiologists that talk about the physical viral load and the spread of the disease. But also, when you're looking at lockdown measures, that's human behaviour. So you then need to consult with social psychologists, social scientists about whether or not people will adhere to it. And one concern that we had was that they seem to be having an overemphasis on an area of psychology that's called nudge psychology, which many social psychologists, myself included, are quite critical of, because it's ethically quite dubious. It relies on subtly manipulating people, but the evidence for its effectiveness is actually quite limited. And the areas of social psychology that I use would very much say, if you want people to comply with messages, rather than trying to unconsciously manipulate them, it's much better to have them consciously identify with the message and they buy into it because they genuinely believe in it and they adhere to it, rather than they're being subtly manipulated into doing something they don't realise, which is nudge psychology. So yes, I think there could be a broader spread of the messages that are taken on board by politicians, and it is a bit skewed. And unfortunately, that's a political decision, that they're advised by scientists, but the advice that they take up and listen to is a political decision. And for example, in The Guardian today, there was talk by a scientist saying that the government acted too late on the advice that they were being given. And unfortunately, we may see the effects of that in a higher fatality rate than other countries that locked down earlier.
Well, yeah, one of the government's advisors, Professor Neil Ferguson, believes that a level of social distancing will be needed until there is a vaccine. Maybe not the measures that we have now, but if there is better testing and contact tracing, there could be some leeway, but that could take 18 months or so until we even see a vaccine. So what long-term effect could that have on people? Because, you know, people need to get used to the fact that we're not going back to normal anytime soon.
Yeah, it's a big issue, and there will be new social norms to adhere to. You know, things like that we are used to doing, shaking hands, hugging, kissing on the cheek. In the new kind of post-COVID social norms, that may be problematic. I'm thinking about it specifically. I've had discussions with friends who go to concerts, because I used to go to a lot of concerts before the lockdown, and there's a big discussion going on about when, if ever, are we going to see large concerts and festivals brought in again. And NME ran a story last week that it may not be till October 2021 that large-scale festivals and concerts come back in, because how do you socially distance in a concert at Wembley Stadium or in the Pyramid Field at Glastonbury? Is it realistic to expect people to stay 1 metre, 2 metres apart? And if people did adhere to that, the social value that people get of going to concerts, to be close to other people that are enjoying the same music as them, that is obviously going to be negatively affected if you are 1 metre away from everybody. So there's a lot of different things to consider about it, and how it goes and how we deal with it is anyone's guess. I suppose from my point of view, as a social psychologist, I would say that whatever norms develop from this in this post-COVID world, if it's accepted that that's a kind of the necessary thing to do to prevent new spikes of infection and to keep people and themselves safe, the wearing of masks and things like that, and new gestures of greeting people. I mean, I found one thing that I was doing recently before the lockdown, which is do the elbow bump, or you touch feet with each other instead of shaking hands. So it may be that we see new norms of interaction. And yes, it's a very interesting question to see how it will go. But yes, I think it will have massive impact socially about how we socially interact.
I mean, you talk about concerts and festivals and how that could take ages until we see them come back. So how premature is it then for, you know, sporting events to talk about even starting again in the coming months or later this year? Because it's the same situation, isn't it? So when those bodies are talking about possibilities of putting everything on from October onwards, they're surely in exactly the same situation as music.
Yeah, again, it's an interesting question, and how they do that, you know, I don't know, and it will be for them to decide. One possible thing, and this will have a massive effect on attendance, is if you have a large football stadium, say the Amex at Brighton Hove Albion, which is by our family campus, maybe a possible way to do it would be to have reduced numbers of people coming in, so you can still socially distance people sitting in there, and people are 2 seats apart from everybody else. Again, that will have a massive impact on the social experience, because the atmosphere of being in a tightly packed crowd in the North Stand, when everyone's around you and everyone jumps up when it's goals, when there's a goal, and sitting there 2 meters away from everybody else, that's not going to be as enticing. I suppose it's possible as well, they might play the matches to just closed stadiums and not invite people in and screen them. But then again, you have the issue, which is what pre-lockdown was, there was a concern that if you have the matches behind closed doors and you screen them out and people are watching them in pubs, the risk of COVID transmission in a small pub rather than a large outdoor stadium are far, far higher. And so all of these things are going to have to be considered.
If, as is predicted, measures are eased but not lifted, so we sort of work backwards from how the measures were brought in, because I think that's kind of how people maybe are thinking it might happen. Is there a possibility we sort of see the opposite to the panic buying? We see too many crowds will gather when they're being advised to have some sort of level of physical distancing, because we've all been cooped up for so long by that point.
What do you mean, that people will seek out being physically closer to other people?
Absolutely, yeah.
I don't think they would do that completely unconsciously, uncritically. People may choose to identify with certain types of people, but I'm not aware that there's any kind of inherent propensity for people to seek out crowds per se. The crucial thing, which is what myself and other people look at, is the degree of identification in the crowd. So, for example, work that a colleague did on spacing and distancing within crowds found that people will tolerate higher crowd density if they identify with the crowd. So say, for example, if you're in a packed crowd at a gig or a festival, you won't consider that an aversive experience, whereas if you're in a packed commuter train going to work and you have no psychological connection with people around you, you're much more likely to report the latter as an aversive experience. So I don't think people will seek out crowds per se, but if, for example, say you have a concert goer who hasn't been to a concert for 6 months because of COVID, and then one of their bands they like are playing. So for example, Manic Street Preachers are putting on 2 stadium gigs in Cardiff to thank the NHS, hopefully post-lockdown. I can see that people will want to go to that because it will be an experience that they've been missing. But obviously, someone who doesn't like Manic Street Preachers probably wouldn't want to.
We're actually seeing from yesterday, talking about Fatboy Slim doing the same thing at Brighton Centre for NHS workers. So we've got a local example of that happening as well in October. So that could happen.
Yeah, they probably won't let him do another gig on Brighton Beach, but that's
no, exactly. No, you're right. That's a whole nother conversation, I'm sure. Yes. Now, with your training background, I mean, there has been speculation that obviously the lockdown, not speculation, I mean, it will happen, that the lockdown could have negative effects on people's mental health, and that creates other problems. What do you think? How big an impact could that have if it goes on for a longer time?
Yes, it is a concern. And my particular area of clinical interest that I worked in is sort of vulnerable children and adolescents. If there are children that are in problematic and complicated family situations, if there's domestic violence, if there's abuse, if there's substance abuse, being in lockdown can be an issue for mental health, but not physical health as well, and safeguarding issues. So yes, it is a real concern. I don't currently work in the area anymore, but colleagues that do are very concerned about that at the moment. And I think what they'll probably be thinking about is switching to more remote forms of therapeutic intervention. So, for example, I know the colleagues are looking at now doing Skype and Zoom therapeutic interventions, because at the moment they can't do face-to-face. Maybe that will be more easy for young people because they tend to be more technologically literate, and they will find it easier to have a therapeutic intervention over Skype and Zoom than, say, an adult who's less technologically literate might be. So it might be more easy for people to engage with these new norms depending upon their age, the demographic, and their levels of technical literacy. But yeah, it's a clear concern, and at the moment there's real physical effects, for example, of increased alcohol consumption at home. People are not going to the pub, and people are drinking more at home. There's concerns about that, long-term effects of that, and obviously the consequent social effects of drunken behaviour if there are family dynamics in the house. So yes, there's a whole raft of things. We don't honestly know how it's going to bear out, how long it's going to last for, but yes, I can see that there's going to be a lot of work for those that work in psychiatry and mental health and wellbeing to see how they can help people deal with long-term consequences of this. Yes.
Do you think that might influence some of the decisions about lifting all these measures?
I don't honestly know.
What would you do?
It's a very difficult one, because you don't want to just get into a simple numbers game of saying, okay, so if we do lockdown and that will prevent a certain number of vulnerable people dying from COVID, you then have the unintended consequence. And I've seen, for example, in the Guardian yesterday, there are an increase in domestic violence related murders going on at home. There is a spike in that. I would guess that's less than the amount of people that were died of COVID, but that's an awful situation to get into, because you don't want to trade one off against the other. So it's a very, very difficult situation to manage, and I wouldn't want to be the person that did, because both of those are tragedies.
The final sort of negative slant on this one, and we've sort of touched on it already with the press, but at the moment we're seeing daily calls from journalists and opposition MPs to find out what the so-called exit strategy is. Does that in itself cause more negativity towards the lockdown potentially, because we always, or do we sort of feel like, do we as humans need to know roughly what the path is ahead of us?
It's a good question, and we shall see. I mean, it's not an area that I'm that expert in, but I do know, for example, of colleagues that work in military psychiatry, where they've done work with people in active service. They found that being honest with people, so for people who are in active combat in situations who want to know when they're going to get out of it, giving them false hope and saying we'll be out in a week and then that not being true is far worse than being honest with them and saying we do not honestly know. So I think you can be honest with people. You can say we're not sure how long this is going to go on for, if you impress upon them the vital need of why they do it. It's not to say that you then don't need to think about possible exit strategies. Whether or not the discussion of exit strategies will then cause people to be more fatigued is an open question. My hunch would be, if you are open with people that you do not know when the lockdown will end, and that's within any discussion about exit strategies, I think people will be able to cope with that ambiguity. So I don't think it's irresponsible per se to talk about exit strategies, but obviously if we're still in the middle of a lockdown, the priority of the message and of the social norm is, for the moment, unfortunately, we still need to adhere to it. What I think is most likely, and again, this won't be my decision or my area of expertise, but I guess that there won't be a complete break of the lockdown. It will be phased and it will be gradual, which is what they're doing in Denmark. They're allowing the less vulnerable groups, young people, to go back to nursery and things like that. So that, I think, would be what any lockdown looks like when it ends, it will be phased. It won't stop all in one go. So the idea that at some point in 3 weeks' time, they'll go, okay, that's it, you've done all your work, well done, everyone can go back to normal as you were before. I think that's not going to happen. So, and being honest about that, I don't think would be harmful. I think people will understand that we can't go completely back to the way things were before in one fell swoop.
Let's end this conversation with bit more positivity. We touched on it earlier, the fact that, you know, we are seeing communities come together a bit more, aren't we? We're seeing a sort of a sense of solidarity, that we are all in this together. We, you know, like you say, I think everyone's sort of talking to their neighbours a bit more. You're a little nod, a little good morning to someone on your daily exercise, if you're just going for a walk or something, or going to get some food. It's a lot more friendly out there, isn't it, at the moment?
Yeah, and it's one thing that I've noticed in the research that myself and other people have done into mass emergencies, is that you get a remarkable amount of emergent solidarity and cooperation, and people really do come together. And I know it's used in a rhetorical way by politicians saying we're all in this together, but there is also empirical evidence to show that people do come together. The example we use, the most stark example I often use is we researched 7/7, and before 7/7 happened, we were asked by people, by journalists, in what crowds might people behave antisocially, what crowds might it be difficult for people to come together and get this solidarity. And I thought, well, if you're in a packed crowd where you're in a physical mass but you've got no psychological connection with people, then maybe it would be more difficult for that solidarity to emerge. And then I remember journalists saying, well, what kind of crowd would that be? And I thought, well, a packed commuter train or a packed tube train in rush hour where people don't talk to each other, you might see that. I'm pleased to say that we were completely proved wrong in that theory, because in 7/7 this solidarity emerged straight away. So people, before the incident happened, who had no connection with each other at all, people don't talk to each other on tube, suddenly then cooperated with each other massively. And it's not that everyone behaves like total lions and heroes or whatever. As you say, it's the small mundane things. It's what we call, it's the oil that wheels the social cohesion. It's the standing back, it's the comforting someone, it's saying, are you okay? It's passing the bottle of water around, finding where there is someone trained in first aid that can come and help that person, and comforting people, holding their hand while they're dying. That happened a lot in 7/7. So it's all those little mundane things that allow the greater cooperative things, the life-saving skills, the helping the ambulance and emergency services to come in. So it's all part of a much bigger picture. And yes, I think that's one very positive thing about this outbreak, is that it is showing people's inherent cooperation when need be, and people do come out and they are there for each other. And that can be a very reassuring thing in these incidents. And every Thursday night, people stand on their street, it happens in my street, and clap the NHS. And it's a very powerful thing to see. It often moves people to tears.
And because this could last for such a long time, could they actually have quite a positive long-term effect then on how we all sort of behave as a community?
It's a good question, and it's something we often get asked, is how long does this cooperation last? Does it just last during the incident itself, or when the danger and the threat has receded, will there be an ongoing residual sense of cooperation? I think in this situation, because I was talking with emergency planning colleagues last night about it, this emergency is unusual in that everybody is affected. Previous incidents, you got a terrorist attack somewhere, a location is affected, and people might feel a sense of sympathy and connection with it. But in this situation, we really are all in a similar boat. We are all locked down at home, talking to each other via Skype. And so that may mean that the bond that is brought from this will last longer, because everyone will share that bond. It wouldn't just be a fleeting thing that you saw an incident and you were in it together and then you move away from the incident. So yes, I think there is a real chance that this bond will last, but we shall see. It's an open question. I hope so.
We're seeing extraordinary appreciation of the NHS, of supermarket workers, bin men, posties, and we're seeing some extreme generosity and extraordinary achievements as well. You know, I mean, £12 million raised for the NHS, like Captain Tom, amazing.
Oh yes, I saw that.
I mean, just incredible, really. And I guess you wouldn't see these in a situation which, in a normal situation, day to day, in our old social norm.
Yeah, if you don't have that sense of connection, cooperation with other people is less likely. And there's many different studies that have shown that, about how and when bystanders intervene. If people don't feel a sense of psychological connection with the people in need, they're much less likely to intervene. Many, many different studies of bystander intervention have shown that. So the crucial thing is not, oh, bystanders don't help, is they can help, but how do we encourage the situations to make them help? And this current epidemic does give the opportunity to that, because getting back to what I said, we are all affected, so we all have the same shared experience. We are all locked down at home, and so we all understand and empathise with each other's situation.
Really interesting stuff. Thanks so much. We end every podcast with the following questions away from work. Yourself and your cat, I can hear there as well.
Yeah, sorry, she does that when I'm
that's
talking.
Good to have extra guests on. Just to get to know. This is just to get to know our guests a bit better. First question is, what advice would you give to your younger self?
Don't be cross with the compromises that your older self may make in the work that he does in getting his message across.
Okay. If you could pick any subject to study at the University of Brighton, something that you're not associated with now, what would it be?
Not associated now, it'd probably be politics or philosophy, because I always feel that I missed out on that side of my studies.
Okay. Pick a favourite place in Sussex.
Castle Hill Nature Reserve, beautiful nature reserve that's a quick bike ride away from the Falmer campus where I work, but it's absolutely kind of in the middle of nowhere, but very, very close to the city I live in.
And let's pretend that all measures are out the way at the moment. If you could give visitors to Brighton and the area a tip of what to do and experience for a weekend or something, what would that be? I'd
say hang out at a bar in the lanes or a cafe in the lanes and sit there and watch the world go by, because that will give you a really good idea of what Brighton is about, and then wander down to the beach later and have an ice cream. Yeah, nice. Tell us something interesting about you which a lot of people may not know. During the 2011 Jasmine Revolution in Tunisia, I happened to be there on holiday, and it all kicked off around us, and we found ourselves in this castle in a town on the coast where the Monty Python Life of Brian was filmed. So we had this bizarre situation where there was a full-on riot going on at the bottom of the castle, and I was filming the crowd destroying seafront properties that belonged to the hated president, and then we realised we were standing in the very spot where Terry Jones from Monty Python did his speech of he's not the Messiah, he's a very naughty boy, which was quite a bizarre situation to be in. Yeah, God, that must be a really odd way to, God, it was a very strange emotion at that point, I imagine. And finally, if you could pick 3 people to host at a dinner party, past or present, who would they be and why? Sigmund Freud, Karl Marx and Guy Debord. Sigmund Freud, father of psychoanalysis, Karl Marx, the author of Das Kapital, and Guy Debord, the author of The Society of the Spectacle. I think it would be quite fun to pour myself a bottle of wine and sit back and watch them verbally spar with each other. Sounds good. Chris, thank you so much for your time today. Really appreciate it. You're welcome. And you can subscribe to our YouTube playlist. You can also subscribe via iTunes, Spotify, and your usual podcast app. Just search University of Brighton. But for now, it's goodbye.